This is a long COVID paper on autoimmune and autoinflammatory connective tissue disorders following COVID-19. Now, I like this little side key because these are the types of things that you want to think about when you're reading a paper. The key question being evaluated is, will COVID-19 increase the risk of autoimmune disorders? This is a cohort study that looked at over 354,000 individuals with COVID and over 6 million controls. And the findings suggest that autoimmune and autoinflammatory connective tissue disorders may manifest as long COVID or post-COVID-19 sequela. This is a retrospective population-based study between October 2020 and December 2021 out of Korea. COVID was diagnosed through PCR, with the mean age of individuals being 52 years, and they had a pretty good 50-50 split between men and women. And the long COVID risks include things like alopecia totalis, psoriasis, vitiligo, vasculitis, Crohn's disease, ulcerative colitis, rheumatoid arthritis, adult onset still disease, Sjogren's syndrome, ankylosing spondylitis, sarcoidosis, and the risk for all of these things increased with the severity of the COVID infection, ultimately underpinning that a COVID-19 infection was a substantial risk for autoimmune and autoinflammatory connective tissue disorders. This study included both individuals who exhibited symptoms and then asymptomatic individuals, where the factor with the highest risk is this one right here, which is ANCA-associated vasculitis, which is kind of wild because it's considered a rare autoimmune condition that causes an inflammation of blood vessels with various manifestations, where the kidneys are the most commonly impacted organs of this. Where for men, the highest risks include adult onset still disease and systemic sclerosis, which again is a rare systemic inflammatory disorder characterized by daily fever, inflammatory polyarthritis, and a transient salmon pink maculopapular rash, which looks something like this. And systemic sclerosis involves hardening and tightening of the skin, which can look something like this. For women in general, the highest risk was the ANCA-associated vasculitis that we already covered, and then also sarcoidosis. And sarcoidosis is an inflammatory disease with the immune system overreacting, causing groups of cells to form clusters of inflamed tissue called granulomas in one or more organs of the body, which can present something like this. For men under 40, the highest risks include the adult onset still disease, it includes the sarcoidosis, and then it includes myocardial infarction. So this is a major issue with your heart. Transposed. So Becquet's disease is one of the ones for under 40 men, which is a poorly understood inflammation of the blood vessels and tissues, where it might present something like this, or like this, or even like this. And for women under 40, we again have the sarcoidosis, we have the ANCA-associated vasculitis, and then we have alopecia totalis. So that's your hair loss.